With momentum building around the forthcoming public inquiry, it's more important than ever to hear this strong, independent and scientific voice. We wish to see a thorough inquiry, one that responds with grace and compassion to the concerns of those that have lost relatives, suffered terrible COVID illness, both acute and long-lasting, and seen their lives and livelihoods turned upside down. One that will identify the severe failings in the UK's handling of the pandemic. We also look to the inquiry to recommend the actions needed to ensure that we have a public health system, an NHS and a social care system that will respond effectively to any such severe threats in the future. Of course, there has been already some probing into the actions of the government and others during the pandemic. At least 25 parliamentary committees have looked at aspects of the pandemic response and produced some highly critical reports. Also, as illustrated this week, the courts have reached judgments about the legality or otherwise of some of the actions that the government has taken. Civil society organisations have also conducted reviews. The organisation Keep the NHS Public established the People's COVID Inquiry, chaired by the human rights lawyer Michael Mansfield QC, and several members of the Indie Sage membership contributed to its evidential sessions. And today we're very pleased to have with us here the co-chair of Keep the NHS Public, Dr. Tony Sullivan, a paediatrician, who's going to talk to us about the inquiry and some of the things that it has raised. Thank you very much. Over to you, Tony.
Thank you very much, Gabriel. I'm going to share the screen, hoping that that works well. And I hope everyone can see that. So thank you for inviting me. The inquiry a year ago was in the context of deaths passing 100,000. It was an outlier across the world, and the government was refusing the calls for a public inquiry led by the bereaved families. We called our inquiry Learn Lessons, Save Lives. And the aim was to give voice to the very people that were suffering the most, the citizens, the families, the frontline staff and civil society. And we wanted to listen to experts and indeed to follow the science in the way that it should be. And we wanted to find out what could and should have been done differently, and indeed to add support for an official public inquiry. And as Gabriel said, we had the benefit and the honour of Michael Mansfield QC and a great panel of experts. We had a wide range of evidence from 41 witnesses in order to meet those aims. Public health, academic research experts, the bereaved families for justice were very generous in their time, and we had civil society representatives for pensioners, disabled people, undocumented people, of which there are 1 million, and frontline staff and unions. The inquiry published its report on the 1st of December, and there's a huge amount, a really large amount of evidence from all those fantastic witnesses on the website, plus the full report and video access to each session and individual summaries. So that is worth visiting. The final report found many, many findings and recommendations, too numerous to even mention here, but worth looking at. The overarching finding is the title of the report, Misconduct in Public Office. We thought carefully about the scope of the inquiry, and I think this is relevant for our discussion today. And we had 9 sessions, 3 broad themes. How well, in the pre-pandemic period, how well had the government left the fitness of the NHS, public health, and indeed society to meet an emergency such as this? How did the government respond, and what public health strategy was adopted? The second section was about the impact of the pandemic on the people, and I think that includes many subgroups, including disabled people, women, and also frontline staff, and the impact of inequalities and discrimination on the outcomes in the pandemic. The third area was lessons to learn on governance and to look at some of the wrongdoings that was there. There was real profiteering from the people's health, because of government policy, and there are real governance issues to focus. In the pre-pandemic period, there were two things that struck us. Austerity had caused a rise in poverty and rising inequality, and that put disabled people and other key groups at heightened risk of illness and death. And the depleted state of the NHS and indeed other public services and local authorities led to an increase in avoidable deaths from COVID-19, but also the ongoing wave of avoidable non-COVID related deaths because the NHS is under such pressure. We had fantastic witnesses, and some of the evidence today is quoting them. So Professor Marmot said, we lost a decade with regard to health equity with regressive cuts. The more deprived the area, the greater the reduction in spending. And a decade of funding stripped from public services, local government and the NHS placed an impossible burden on the NHS. Professor Scally told us that there was a conscious running down of public health. If the system had been operating well and run by public health people, we would have coped much better. We have governments that have no interest in the public health of the population. Sorry. On the government response and public health management, there are so many issues that are so familiar to the people here, and Indie Sage have been following them for over 18 months. So I'm really not going to list those, to go through them. But there was a serious issue, an overarching concern that the public services and the expertise of public servants was bypassed by government without any justification, and that was disastrous. The impact on the population and frontline staff was given testimony by many people, but Lobby Akinola was the first from the bereaved families, and he said that his father, who might have had a lung infection, was prescribed antibiotics, but he died at home shortly after receiving them without ever seeing a doctor. So there was a breakdown of usual NHS care. There was a neglect of elderly care homes and staff, and highlighted by Jan Short, the attitude of government, the lack of respect and value for older people's lives is shown starkly in this one act of arrogance, the discharge of people from hospital into care homes without a negative test. And the attitude to disabled people underpins the disastrous fact that 6 out of 10 people who died from COVID were disabled. Ellen Clifford told us that disabled people have been disproportionately affected, the overzealous limiting of access to intensive care treatment, and the abuse of do not resuscitate notices. We had very powerful testimony from frontline staff. NHS frontline staff in the beginning of the pandemic, and even now, had no PPE. So Michelle Dawson told us that porters on 0-hour contracts were still having to move infected bodies with no body bag, no mask, no gown. We saw colleagues dying. We were terrified we would be the next, and you just have to keep going. Staff told us about the conflict where their professional expertise and their clinical management duties told them what they should be doing, but they were unable to meet those demands because of the crisis of care in the NHS, and that was moral injury. Health and safety duties were ignored, and Raymond Aegis told us what the obligations were. An employer should take steps to protect their workers. People who take this burden of exposure to COVID by virtue of their work deserve that level of protection as a precondition and the right levels of personal protection as a fundamental right. Other frontline workers outside of health and care were also very badly affected. And we had a tube driver from the Victoria line talking about his conversations with London bus drivers who told him that they were just totally abandoned. The lack of any safety measures to protect the drivers was quite astonishing. The death toll was tragic. The third domain was about profiteering from people's health. And Sir David King gave a very powerful testimony when he appeared. In the middle of the biggest pandemic in over 100 years, government set up private companies with no healthcare experience to run, test and trace from scratch. I believe that was a disastrous decision. We heard during our inquiry that privatization policies had certainly cost lives. Privatization affected the pandemic before it even occurred because there was a privatization of procurement and there was a just-in-time policy that said that, that there was like a sort of commercial principle not to waste money. But this failed to provide PPE to the front line when the pandemic struck with disastrous consequences. Outsourcing prevented more successful, safer outcomes than the public sector would have done. Private hospitals were given billions of pounds for less work for the NHS than they were doing year on year pre-COVID. And private contracts gave unprecedented access to personal health data. And this is an ongoing concern. There were serious failures of governance. The Nolan principles on behaviour in public life were all breached, absolutely fundamentally. There was a lack of government honesty, which undermined public trust. There was secretive and, as we've heard, often unlawful contracting, and that allowed profiteering. There was a failure to protect the population. Health and safety regulations were breached, and there was very little monitoring and action on health and safety. And probably there was a breach of international health regulations also, because we heard from a lawyer in public law that states are under a duty to respond promptly and effectively to public health risks and emergencies of international concern. Our overarching conclusion is that change must happen now. It mustn't wait for the public inquiry. It must happen now. There are grounds for concern for criminal charges, for corporate manslaughter, where gross negligence has been manifest and led to death, and misconduct in public office, a common law offence where behaviour has been sufficient to abuse the public's trust. And we have referred our concerns to the Metropolitan Police. But finally, there are legal and moral accountability questions for the public inquiry to address. We believe our report has important recommendations and findings, and we will be attempting to make them available to the public inquiry. We believe that strong public services are the bedrock of a successful and a safer society. But inequalities must be now at the top of policy agenda across departments. Commercial interests, practices such as just-in-time, undermine the pandemic response. And for the public inquiry, the scope, the terms of reference, and witness selection are absolutely key to get to the truth. It must address what happened and why, and not just future plans for future pandemics. It must include accountability now, and that will allow us to correct lessons to be learned for the future. So thank you very much for listening.
Thank you very much, Tony. Thank you for going through what was a lot of work in a very short time there. Are you optimistic for the public inquiry? Do you think there is a chance that it will do what you would like it to do?
I think there's a huge public focus on it. I think Boris Johnson is under enormous pressure to avoid the truth coming out. The worry is that the timing of it will be after the next general election rather than before it. I have great faith in the determination of the COVID-19 bereaved Families for Justice and the fantastic campaign that they've led, that will prevent the restricted scope. But the Prime Minister sets the scope and the terms of reference for this inquiry. The Baroness Hallett will apparently consult on what Boris Johnson gives her, but I'm not sure whether that consultation will be in public or not, and we need to make a fuss about that and campaign for it. I believe that the public inquiry has the capacity to get to the truth, but how quickly it will do will depend on forces, I think, campaigning forces, and the integrity of people like Independent Stage outside of the inquiry. And we hope to be involved by becoming a concerned party.
Thanks very much, Tony.